most common major medical condition among adults. In the US alone, chronic pain is estimated to affect over 50 million people and cost $635 billion annually, more than the annual cost of heart disease, cancer, and diabetes combined. About 18 million adults in the US live with chronic pain that limits their ability to complete daily activities. Chronic pain has several potential mechanisms that are common to the many possible causes of chronic pain. The good news for patients is that our understanding of these pain mechanisms has advanced dramatically, and there's substantial research into the treatment of chronic pain. Spinal cord stimulation is one of the most exciting technologies for the treatment of chronic pain and has been well studied in clinical trials. Spinal cord stimulation, or SCS for short, is an FDA-approved, opioid-free, outpatient implanted therapy that treats chronic pain by using electricity to block pain signals as they travel from various parts of the body and along the spinal cord on the way to the brain. It is a minimally invasive and highly effective treatment which can provide many years of pain relief. Additionally, the stimulator device can ultimately be removed if necessary. Spinal cord stimulation was originally introduced as a treatment for chronic pain back in the 1960s. It was officially approved by the U.S. Food and Drug Administration in 1984, though early models were relatively large and had to be worn outside the body. However, technological innovations have now produced spinal cord stimulators that are much smaller, fully implantable, and capable of providing more substantial and reliable pain relief as technology has matured. Many of the components of spinal cord stimulator systems were adapted from the hardware developed for pacemakers used in the heart. Today, spinal cord stimulator systems are the same size or smaller than pacemakers that many individuals are familiar with. Spinal cord stimulation can provide significant long-term relief from a variety of chronic pain conditions, including sciatica, spinal stenosis, spine disc degeneration, chronic post-surgery pain, diabetic peripheral neuropathy, and complex regional pain syndrome of the extremities. The device that performs the SCS therapy is called a spinal cord stimulator. The permanent stimulator consists of two parts: a small implantable pulse generator, also referred to as the battery, and a pair of thin wires with electrodes on the tips, called leads. Before performing a permanent device implantation surgery, a 5 to 7 day temporary trial is always done first in order to confirm that the patient will benefit from the device. If the trial shows that SCS is effective for a patient, a permanent device may be implanted 2 or more weeks later. The SCS implant procedure is a same-day surgery with 2 incisions, each about 2 inches long. At that time, the leads are carefully inserted through an epidural needle, which passes between the vertebrae. The leads are then positioned just inside the bones of the spine at the level needed to help block chronic pain signals based on the patient's exact pain pattern. The other end of the leads is then connected to a small battery, which is implanted in the low back or the upper buttock area. No bones are cut and no structural changes are made to the spine. The only change is the addition of the SCS device, and all components of the system are implanted under the skin. The battery emits mild electric pulses which are carried to the spinal cord by the leads. These electric pulses are typically given at a frequency that the patient does not even feel. The leads apply the electricity to the nerves, stimulating them. Pain is reduced because the electrical pulses intercept and mask pain signals before they reach the brain. There are a number of factors that can make SCS a preferable alternative to medication treatments, repeated injections, or surgery, and are best discussed with an experienced clinician. This therapy is covered by most insurance plans and can provide at least as much pain relief as opioid medications without many of the risks and negative side effects. All of the stimulator models used by our practice can safely enter an MRI scanner with the patient. Most models have batteries with a footprint about the size of a silver dollar, and rechargeable models can last 10 years or more. Twin Cities Pain Clinic is one of the foremost spinal cord stimulation authorities in the Midwest, with our physicians performing hundreds of trial and implant procedures each year. If you or someone you care about suffers from chronic pain, contact Twin Cities Pain Clinic to see if spinal cord stimulation could be the answer to helping treat your pain and improve your daily function. Thanks for watching. We'll talk to you next time.